Welcome everybody to Heritage Victor Valley Medical Group. Somebody give me a bam!
Yeah!
Yeah, baby. There you go. Well, welcome. Tonight is our very first ever high performance clinic. And what you're going to see tonight, what you're going to hear about tonight, is fitness taken to a whole new level. All around the country we have fitness going on, but they stop at people walking in the door and going out of the door. Well, tonight we're very, very honored to have Dr. Jay Rook with us. He's new on staff here at Heritage Victor Valley Medical Group, and he is our team doctor, and he's going to tell a little bit more about himself. But tonight he's going to talk about what is the high performance clinic, what is high performance fitness all about, what it is that he can do not only for you as Heritage members and Heritage fitness people, but what this high performance clinic that we're going to start here at Heritage Victor Valley Medical Group, what it can do for anybody who chooses to join us, and what it can do for anybody who's generally into fitness. So with that said, and no more messing around, let's have a big hand for Dr. Jay Rook.
Thanks, George. Thanks, everyone. Thank you for coming. How many people in the audience right now are Heritage members? Is it pretty much everyone? And then non-members? A few? Okay. All right. On the fence members, maybe? Okay. All right. So, again, thank you for coming. As George mentioned, this concept of high-performance clinic or high-performance workshop, when we first started talking about this, the idea was that we were going to do focus talks. And we are. But I realized that rather than starting with that, we needed to start from the beginning. We needed an introduction into what this concept is. What does it mean to be an integrative athlete wellness physician, a team doctor? Because it's a concept that is foreign to a lot of individuals, and it's a concept that's very foreign to an organized medical group. This is something incredibly unique that Heritage is doing that you don't find in other medical groups. If you can envision, and does anyone know, have they ever heard, have they been to, know anyone who's ever gone to a concierge clinic? Have you heard that term before? Okay. Have you guys ever seen the show Royal Pains? Yes? Okay. I hate that show. Because it's ridiculous. The medicine on it is ridiculous. So I watched it once, but that you understand that concept. He is in a wealthy area, a doctor that's kind of on call for a group of people who have bought his service. That concept of concierge medicine has taken off in the last 10 to 20 years. And there are more and more practices like that evolving throughout the country. And in fact, I came from one of those before I joined Heritage. It's what I was doing in between being an emergency medicine doctor and really making this transition into what is a more exciting field for me to work in. In the concierge concept, we would have members who would basically buy the opportunity to be part of our care and our service. And that meant focused healthcare, that meant performance optimization, and then in the particular group that I worked with, we had our own gym and trainers, and we had a space that as we would have evolved, we would have had physical therapy and chiropractic, massage. We would have had high-performance sports testing. That's the idea that we're bringing here to Heritage. But instead of having to buy a membership to it, your membership in Heritage is that membership. Now, if you're not a member, there are services, there are reasons you can come to see me. If you have a PPO insurance, you can see me. And there are some things that I may be able to offer in treatment that will be covered by your insurance, but there are some things very specialized that are not going to be covered by your insurance. That if you and I decided to do those things, and I'll talk more about those as we progress through this talk, those things are going to be covered by Heritage. That's incredibly unique because there is no other place in the country, no other provider, whether they are on their own, freestanding, they're associated with a hospital, they're associated with a medical group, that are paying for some of the procedures that I can do that can help in particular injuries or certain pain conditions. So this opportunity that exists, but I think the issue is that a lot of people still don't really understand it. If I were to just open a clinic on my own and market it, it would make sense because you would kind of see why I would be there and you'd go, okay, I have my insurance, but I want to pay extra to go do this. And that's why concierge clinics usually thrive. But again, in this setting where a medical group, a managed care organization typically focuses on primary care and subspecialty care, which in our country is largely disease. Despite the fact that our National Institutes of Health represent disease, not health. And most of what we do in standard primary care and subspecialty medicine is focused on not keeping people healthy, it's treating people after they're diseased and trying to get them healthy. And we're not doing that well with that battle. And it's not just here in Southern California, it's nationwide. We are losing that war. And so when people like George, when people like Merlin, when Heritage comes along and recognizes the importance of fitness and being healthy and being on the front end and minimizing or avoiding chronic illness and having opportunities for people who have unfortunately already encountered chronic illness and having strategies to prevent that from becoming worse, to prevent it from progressing, and getting them back to an optimal level of health. And now we have this clinic concept. So with that being said, what I want to do for the next few minutes is just talk a little bit more about what it is that I'm here to do, what I can offer, why that might be important to you as an individual, why you might want to come see someone like me, and then describe some of those particular procedures because maybe some of you have never heard about them. And if you have heard about them, maybe you still don't quite understand what they are. And then I want it to be kind of a question and answer. I want it to be interactive. Now that doesn't mean that I'm going to diagnose anyone tonight. I can't do that. But we can talk about things if you have questions about some of the topics I've talked about. If you have a question about a particular thing that you're going through or wondering about or wanting to achieve and whether or not that might be pertinent to come into this clinic. And then we'll talk a little bit about what it means with what we're going to do with this space, which this picture doesn't do it justice. This space, 8,000 square feet, that's not just this. That's these walls out of the way. That's going into the next two suites. 8,000 square feet of workout space. Each individual workout that Heritage Life Fit already does having its own salon. Spartan and CrossFit having their own just gnarly hardcore area where stuff can go on and workouts can happen overlapping and all day long. So no more of well, one group can only work out at 6 o'clock at night on Tuesdays because at 4 o'clock on that day, there's other groups there, okay? More activity. And this clinic, this idea is going to be embedded in that. So you guys are accustomed to going to a doctor's office where either it feels like a sterile old college room or a hospital, or maybe, if you've been to our waiting room here in the primary care in Suite 21, which is gorgeous, right? You feel like you've walked into a 4 or 5 star hotel, but it's kind of calm, it's kind of quiet, that's the point. You come to my clinic, you're not gonna quite get that vibe, right? It's gonna be a little loud, it's gonna be a little noisy, there's gonna be music, you're gonna hear what's going on in the gym. I want that. But when I see you in an exam room, there's still gonna be that privacy. There'll still be some quiet, it's still gonna be personal, but it's gonna have that different tone because it's all about the athlete. It's all about trying to be better, stronger, more fit, and healthier. And even if you aren't really an athlete, okay, if you're not someone who is living every day, no matter what it is you do, you're an accountant, you're a lawyer, you're a doctor, you're a restaurant owner, you're a waitress, but every day revolves around when am I going to get out and do that activity, okay? If you're just someone who a couple of days a week likes to get out and work out, but you want to get better at that, or you want to find some way to feel stronger or healthier, then that's a reason maybe to see someone like me and be involved in this kind of clinic, okay? So the idea of integrative and athlete wellness is based in optimizing health, remaining healthy so that we're not chasing disease. That means whether you're 20 or whether you're 60, trying to find ways through nutrition, through exercise, through habits, through bioidentical hormones, to maintain that youthfulness that all of us want as we continue to get older. And one of the interesting things that I've learned and seen over the last decade is that it seems that as more and more sports and activities like Spartan and CrossFit become more popular than, say, what was popular in the 70s and 80s when it was jazzercise and maybe just, you know, go lift weights or go out and run, is that we are finding more people who, as we get a little bit older in our lives, we get past that third or fourth decade, we still want to keep competing and feel strong and feel energetic. And in some cases, maybe even more so when we hit our 40s, our 50s, and 60s than we were in our 20s and 30s. And sometimes that's because when we were in our 20s and 30s, we felt like we could live forever. And so maybe our lifestyles weren't as good as they have become as we've gotten older. That is another thing that is important with this concept in medicine and this kind of clinic. So integrative wellness is about identifying from an individual standpoint. And functional is another term that's used with this kind of medicine, functional medicine, which means that it's down to the root level for the patient. So it's about your objectives. It's about what it is you're hoping to achieve. And if you come to see me, it's also about me helping you, potentially for my benefit, evaluate how realistic your objectives are. And the reason that I say that is that it's not uncommon that I might see someone who wants a six-pack set of abs because their favorite athlete or favorite movie star has them. But they have certain habits that they really don't want to give up. But they really want those abs, okay? Well, the two just aren't necessarily congruent. So it's my job to kind of, mitigate that. And in some cases, there are ways, and you can mitigate that. In other cases, you don't quite get there. But, when you go see a conventional doctor, you're used to kind of going in because you have a complaint, whether it's my elbow hurts, I have a sore throat, my chest pain, my high blood pressure is out of control, I get really dizzy when I eat, or I have diabetes. So it's kind of hard to fathom why I might go to a doctor when I feel good, and what am I going to get out of that? And again, that's why I say that it's about going back to objectives and goals, and evaluating is the idea that you want to get more performance out of whatever workout it is that you're doing. Are you comparing yourself to some of your counterparts and feeling that they're lifting heavier or running faster or having better endurance or feeling better the day or two after a workout than you are, but you're fairly certain that you're doing about the same thing that they are? Those are things that we can evaluate. And sometimes we find out that it's nutrition. Maybe what you think you're doing with your nutrition and the way that you're eating and how you have deemed it clean or whole has some gaps and some rooms for improvement. Maybe it has to do with your recovery, your sleep, your hydration. Maybe it has to do with an underlying medical illness. Maybe it has to do with hormones. Maybe it's an injury. Maybe it's your biomechanics in the way that you do your workouts. Those are things that I can help identify and try to find strategies to improve and get you to that point where you want to be performing where you would like to be. Maybe it's also about going back to identifying whether or not the objective or the goal is realistic with the resources or the give and take that you're willing to concede, if you will. So that's one component of what this clinic is about. The other component, and that's that exciting part where I was talking about, where Heritage is really, really different in that they are allowing me to perform these procedures on patients. And if you're a Heritage member, we're covering those procedures. And these procedures fall under a group of medicine, or a category of medicine known as regenerative injection therapy. And there's two procedures that I'll mainly be doing. And there's one that I've been doing, and there may be a few people in here that have had one or two of these procedures done, and it's called prolotherapy. And then there's another one that once we're in this space, I'll be doing, because we'll have more room for it, I'll have the equipment, and I'll have staff trained, and that's called PRP, or plasma-rich protein injections, okay? These types of injections are surgical alternatives for either pain issues, for tendinopathies, for minor tears and ruptures, and in some cases, maybe even for significant tears or ruptures in situations where either an individual doesn't want to undergo surgery or is not a candidate for surgery. So classic examples of where prolotherapy, or PRP, may be done are the elbows, the knees, the shoulders, the ankles, the wrist, and in some cases, the spine, the back and the neck. No, I won't be doing those procedures because they involve a little more risk to the patient and a little more in-depth sedation for the patient that it's not that I'm not capable of doing, but requires us to have a setup that's a little bit different. And in those cases, if I'm injecting into the spine, it really is a better idea for me to use some type of imaging to make sure that I don't hit a structure that I don't want to. When I'm injecting knees, elbows, shoulders, my understanding of the anatomy is sufficient enough that I can put the needle where I need it to be and minimize the risk of hitting anything that I don't want to. Anyone in the audience heard of any of these procedures, had them done, know someone who has? Okay, so prolotherapy involves what we call an irritant solution. That sounds scary, injected into an area where there's injury or pain. There are a variety of different techniques that practitioners will use, substances that they will inject that make up their irritant solution. In my case, I use 50% dextrose, which is then diluted down to either a 15% or a 25% solution, depending on whether or not I'm injecting into a joint, an intra-articular injection, or outside of the joint, an extra-articular injection. And I make that dilution with lidocaine, which is an anesthetic, and normal saline. And the reason that I use that combination is because the likelihood of a reaction to that combination, whether it's a 25% or a 15% dilution, is relatively minimal. All of us have sugar in our bodies. So the likelihood you're going to have a reaction to sugar is pretty low. All of us have water and saline in our bodies. So the likelihood that you're going to have a reaction to that is pretty low. The anesthetic is the only limiting factor. Most people at some point in time in their life have had some type of anesthetic injected into them, especially if you've had a dental procedure or anything else. Now, obviously, if I do find that someone is allergic to an anesthetic, there's a way to mitigate that. With prolotherapy, I'm making several small injections where I'm injecting about a half cc of this solution into or around an area where there's an injury. The science behind this is that stimulates the body's normal healing inflammatory response. Now again, you may think, wait a minute, most of the time I hear inflammation, we want to fight that. I take an inflammatory if I have some type of inflammation. And that is correct. This, though, is a normal phenomenon, and we want that. When your body has an injury, there is a normal process in your healing response that involves inflammation and involves healthy tissue and healthy growth factors going to an area. Most of the time when this type of treatment is done, it's done because an injury has been subacute or chronic and the body has stopped making that inflammatory response. And so this procedure is used to re-stimulate that. It is a procedure that is done several times over the span of about 2 to 6 weeks, depending on the age of the patient and how many other medical issues they have or how they tolerate each individual procedure. And you'll typically do at least 3 before you can really define whether or not it's having an effect, and a maximum of 10. This is a procedure that in any other setting, as a non-HMO member, or rather as an HMO member, covered again, let's remember that. In any other setting, anywhere else in the country, typically cost, per time you do it, per location, $300 to maybe $600. So you can imagine if I saw you for a minor meniscal tear, osteoarthritis of your knee, epicondylitis, which is pain in your lateral elbow that you may get from repetitive action, okay? I actually call it an epicondylosis. So itis means that it's more of an acute thing. Osis, though, means that it's turned chronic, and that's why it's not getting better with other conservative treatment. Wristbands, forearm bands, physical therapy, anti-inflammatories, okay? So you can imagine that if you were to find someone else to do this and you were having good results, you had walked around for a period of time with some type of injury or pain and ended up having 8 or 10 of these procedures at $300 to $600 a piece, it's a substantial investment, even if you get a good result. So it's a really exciting thing to be able to do this in this setting and know that I can offer this to patients and have good outcomes. And this is a procedure that's very well tolerated by most people, even if you're needle phobic. And I have ways to kind of anesthetize the area with some topical numbing medicine. And then, depending on how good your pain tolerance is, I can use some topical ethyl chloride spray as well before each injection. So you really don't feel much. And usually, as we progress through these procedures, any of the discomfort that you experience gets less and less. And part of that is because the healing process is doing its job. So PRP, on the other hand, is a little bit like stem cell procedures. Now, I'm sure most people in the audience have heard about stem cell procedures. Maybe you've known someone that's had a stem cell procedure for some significant illness. Now, I'm not harvesting bone marrow from anyone's hip or from the bone in your shin. Some practitioners who do PRP actually do harvest from the bone in your shin. And it's actually not a difficult procedure. We actually can use a drill that I would use in the emergency department to put IVs in if we couldn't get an IV in fast enough through a vein, and you really don't feel it. But I don't think that I need to do that in the clinic. So when you do PRP, you actually draw blood from someone's arm. Most everyone's had blood drawn. So you take whole venous blood, anywhere from 20 to 60 cc's of that blood. And then while the patient's waiting, over the course of about 45 minutes, you use a centrifuge and you spin that blood down 2 different times, each time at a different speed, and each time that you spin it down, you separate out a little bit of that whole blood, getting down to that plasma-rich protein. And you siphon it out, mix it into the second little tube, spin it down until you get the little product, which is the PRP. And so from about 60 cc's of whole blood, the yield is typically about maybe 7 cc's of PRP. So it's not a lot, but it's very potent. And then you take that and re-inject it back into an area where there's an injury. Now the cool thing is that PRP and prolotherapy can be done on the same patient, the same injury. Not at the same time. I wouldn't do them in combination. I would usually space them out a couple of weeks apart. Now PRP, because it's a little more like stem cell procedure, really has the potential to increase growth factors and stimulate new tissue growth. So this is something that if you have a more significant injury, can be done in isolation and have profound results by itself without prolotherapy. Now, whereas prolotherapy, I may do up to 10 sets of injections, like I said, spaced out 2 to 6 weeks apart. PRP, you'll do a max of 3, and these will be spaced out usually about 4 to maybe 8 weeks apart, even if you're a younger or healthier individual. Now this, as you can imagine, is a little more in-depth of a procedure, and so it's a little more expensive out in the real world, is what we'll say. Most cases, this is a procedure that costs about $1,100 to $1,800 per procedure, per time that you do it, per location. So again, if you imagine if you're someone who's suffered with bilateral knee pain, it's not amenable to surgery, maybe you're not a candidate for surgery, maybe it's not quite significant for an orthopedic surgeon to want to deal with it, but it's significant enough to affect your daily living or your activities, and you want to undergo this procedure. Both knees, $1,800 a pop, so now you're at $4,000. Maybe it takes 3 sets to get enough resolution or complete resolution, that's $12,000. So again, as a Heritage member, this is a procedure that we will be doing in the coming months, and it has remarkable results. And again, because this is your own blood, the likelihood of any type of adverse reaction is very, very low. Now, I can't claim that either of these procedures don't sometimes work. They don't sometimes have bad reactions. Everyone's unique, everyone's different. So there are sometimes people who don't respond to these treatments. There are people sometimes who have worse pain after. It is a relatively common phenomenon with both procedures to feel a little bit of discomfort for a day or two after the procedure, and that's a normal part of the process. But for it to be sustained is relatively rare, but there are some individuals who do experience that. So what does this mean, though, for an athlete? What does this mean for someone who's been injured while they're working out? Well, I mentioned earlier that typically these procedures are done in the subacute or the chronic type of situation. However, interestingly enough, a little bit here in the US in professional sports, and a lot more in Europe, because they're a lot more liberal and in some cases a little more forward thinking with more alternative ways of managing injuries. These types of procedures will be done in athletes who have an acute injury if it's a matter of getting that athlete back out on the pitch or on whatever playing field or activity it is that they do. So that means that that's a consideration that I can look at case by case with our particular athletes, depending on what it is that you're training for or doing. Again, with the recognition that in some cases doing it in an acute setting, we don't have as much knowledge and data about what it changes or affects in the long term. So, but again, it's an option out there, and this is something you're not going to find with our other physicians here at Heritage, and you're really not going to find too much up here in the high desert. Okay, so that's another unique aspect of what it is that I can offer, and you may think about in your respective journeys and goals and objectives personally or athletically with my clinic. And one important thing that I probably shouldn't overlook is that even though we keep talking about this space in the future, in the next couple of months, once we're done building the new senior facility, which, just if I can put a plug for that, if you guys get a chance to go down and see how amazing that is, to understand, again, what it is that Heritage is doing for its members and for this community. and something we'll have access to through Heritage Life Fit and the high performance clinic and workshop, because we're going to have a full demonstration kitchen down there, which will not just be exclusive to our senior members. We will find ways to utilize it as many days of the week, even on weekends if we can, which will be really, really exciting for a variety of reasons. But once that's completed, and it's only a few weeks away from completion, then things are to begin here. But I'm seeing patients now. I am in Suite 21, and even though it's our primary care office, I have facilities there, and I can see you for injuries, I can see you for nutrition questions, I can see you for general medical issues that you may think are related to your performance or your well-being. I can do prolotherapy, I can do manual therapy, and again, there are some people in the audience who have seen me for some of the manual therapy that I do. I'm an osteopathic physician. It means that I'm a DO. I went to an osteopathic school. There are two routes to being a physician in the United States, an MD school or a DO school. They're essentially the same these days, with the exception that in a DO school we have 8 semesters. I'm looking at my wife because she's, right? 8 semesters, our first 2 years of osteopathic training, which is focused on manual medicine, meaning that we study the anatomy of the body, the musculoskeletal system, a little bit more than our MD counterparts. And in addition to learning all about pharmacology and microbiology and immunology and surgery and all of the other organ systems, we also learn about how disease affects the musculoskeletal system and how the musculoskeletal system affects disease. And we are trained in ways to treat the musculoskeletal system, to both treat acute musculoskeletal injuries, but also to treat and or diagnose musculoskeletal aspects of various chronic illness or non-musculoskeletal disease. Some of what we do may seem similar to what chiropractors do. And the reason for that is because the very first chiropractor who founded chiropractic was a student at the very first osteopathic school back in the 1800s. He decided, after learning just the manual aspects of medicine, that he didn't need to learn anything else, and went off and founded chiropractic. But there are many other things, obviously, as physicians that we've learned that separate us from what a chiropractor does. Now, I don't do a lot of the spine cracking and adjusting. More of what I do focuses on muscle energy and a technique called active release technique. And if you've been one of my patients, then you probably know that it is a bit of a painful treatment, but it usually has very good and very rapid outcomes. And active release therapy is about identifying restrictions in muscle tissue and then engaging those as the practitioner and either actively having the patient move that muscle or muscle group through its range of motion, or passively, where then I will move it through the range of motion. So it is a wonderful technique. I have been on the treatment end of it, either by my wife, who's in the audience, and maybe we'll get an introduction later. She's shaking her head no. Or we have a friend who is a very well-trained chiropractor who does actually more of this in his clinic down by where we live. And so I have been on the receiving end of this, and I know how painful it is, including some 4-letter words that have come out of my mouth as I have been on that. But it works wonderful. And it's a modality that I will use, but I don't use it in exclusion. I can combine it, again, with things like prolotherapy. I can combine it with trigger point injections. I can combine it with standard medications if I have to. And again, there are some patients in the audience who have been on the receiving end of a combination of those treatments. So, and again, I think that's a relatively unique thing that I can bring to Heritage into this clinic, that again, as you think about why might I go see someone like Dr. Rook, that may be the reason. So then the other interesting piece is this whole idea about performance optimization. And there's 2 categories for that. There's truly the athlete component. And then there's just kind of the in general. And the in general could mean I'm an athlete, but I'm not really thinking about how I want to be feeling better or stronger or have more energy in terms of my athlete stuff. This is affecting more of my regular life, who I am outside of being an athlete. And this, to some degree, focuses a little bit on what is known in some circles as anti-aging medicine. And that revolves around the concept of bioidentical hormones. It's a matter of evaluating men and women's testosterone, estrogen, progesterone levels, thyroid levels, to understand whether or not there's deficiencies or deficits or areas where any of these, either in isolation or in a combination, can be optimized. Improving any of those by themselves or together makes significant differences in individuals' moods, energy levels, endurance, strength, lean body mass, recovery, libido, enjoyment, erectile dysfunction. If you match hormone optimization with good activity, which the majority of you are members of our Heritage Life Fit, so you guys are already very well committed to active lifestyles. If you match it additionally to very good nutrition, and I'm not talking completely restrictive nutrition. I'm talking good whole nutrition within reason. The results you get from hormone optimization are that much better. I have seen and treated individuals who didn't want to change anything about their activity level, didn't want to change their diets for whatever reason. But I would correct a testosterone deficiency or an estrogen or progesterone deficiency, and within several weeks, they would notice that mood is better, libido is better, energy and endurance have improved, clothes are fitting differently, scale numbers are changing. And I'm not a big fan of the scale unless there is a particular body composition goal and a particular reason that we're shooting for it. The scale is a big enemy to me because it gets in the way of things. That's a side tangent. Okay? But matching it with good nutrition and exercise, you can get phenomenal results. Now, in the professional realm, optimizing hormones, even testosterone, falls under the category of performance-enhancing drugs, or PED, and it's a big no-no, okay? I don't know of anyone in this audience right now that's a professional athlete. So even if you are competing personally for Spartan, you are racing independently on a mountain bike, optimizing your hormone is an advantage for you that is, it's not illegal and it's not unsafe. When I prescribe hormones, I'm not turning people into Arnold Schwarzeneggers, okay? And I've seen, now believe me, I've seen some people who come to me and I usually screen them out and I never see them again because that's what they want. I don't prescribe it that way. Those types of things are super physiologic doses of those hormones. It's not safe to do it that way. It's not healthy. You'll get phenomenal, very explosive, very quick results. You'll typically, if we're talking testosterone, that's where the characteristic roid rage comes from. When you have very, very high levels, abnormally high levels of testosterone. Testosterone is important to men and women, believe it or not, and I have placed women on testosterone and seen wonderful results. And when I see the couples, if I'm just treating one, let's say that it's husband and wife or boyfriend, girlfriend or whatever, but let's say that I'm just treating one, but they both come to the visit. Typically, it's both that have have seen the benefits and are excited about the outcome. Now, obviously in women, testosterone is not as important of a hormone, and I'm not trying to get the levels to the same range as in a male. But again, it is important, and it does play a role in your lean body mass. Now, that being said, I'm not a practitioner that believes every single person I see needs to be on hormones. Some of the people who have decided to get into this practice of medicine, because it's a very lucrative practice of medicine if you are in the outside world, everyone has a hormone problem because everyone's going to then pay for you to treat them, okay? I don't see it that way. There's an optimal range of hormones, and there's a set of symptoms that are important to evaluate and optimize. I look at both and make those decisions along with the patient. Sometimes I find that there's some other medical issue going on, and again, as a medical physician, because some people who are practicing in this realm of anti-aging functional medicine, they're not physicians. They are mid-levels. Some chiropractors are doing this. Some naturopaths are doing this. They don't have the same understanding of physiology and pathophysiology. So there have been some cases where something has looked like it might be a hormone deficiency, but I've actually identified another medical illness that needs to be treated or referred out to a subspecialist. So again, if you come to see me, you at least can know that that's always in the back of my mind, and that you are safe, in that I am making sure that your health is the first and foremost priority. And it's not just about the fun stuff of, being more energetic, or that better libido, or the pants fitting a little looser, or for guys, the shirt's fitting a little more snug, or, the bicep looking good when you flex the arm. So, okay. So, and then the other aspect of this clinic, and I'll wrap it up there. My wife is doing this, so, is kind of what we wanted with this clinic, in that this idea of access. That's a huge problem in the medical world right now, right? And especially for people who are generally healthy, because most primary care doctors are inundated. I feel bad for my primary care colleagues because they are inundated with unhealthy patients every day who come in with bags of medication and laundry list of problems. And so when you call, if you're healthy and you've got an acute elbow issue or a sore throat, or maybe just a question about your health, you guys know this, it's hard to get in. That is the other thing that we are going to make sure with this clinic, that there is good access, that you can get in to see me, and as we grow, that I have colleagues with me who have the same mindset. They may not all have the same training, they may not have the same knowledge, they may have different aspects, but that we have a team of individuals so that those other issues we can address promptly, so that you're not waiting 2 to 3 weeks to get in. You're not having to use our wonderful urgent care, which is still there and which is still an option, okay? But you have that ability to see someone who knows you and that you know and that you feel comfortable with, okay? And then one last thing, and then I'll turn it over to a little Q&A, is that, again, as this grows, we envision, again, this idea of this team doctor mentality, this athlete optimization. What I hope to see here is our own on-staff chiropractor, an acupuncturist, other physio recovery aspects, maybe a cryotherapy or a cryobath, maybe a massage therapist, maybe a doTERRA salon, if we can have that here. Some of you guys have probably heard me talk or have met Marley from Bodymetrics and have heard about her body fat testing and VO2 testing. Those are things I would like to have up here as well. So again, imagine as an athlete, you're working out, you get an injury, maybe you're able to slide right in and see me. Maybe we have the recovery area that you don't even necessarily need an appointment. You can slide in and take advantage of some of those recovery aspects. Cryobath, TENS unit, Normatec, which is almost kind of like if you guys have seen people in the hospital that wear the little leg things to keep the blood flowing when they're lying in bed. Normatec is kind of like that, but you sit in a chair and it's kind of moves the muscles and gets rid of that inflammation and mobilizes the fluid to help cut down on that delayed onset muscle soreness that you'll get sometimes after a really hard workout. So, these are ideas that I have. These are things I hope to bring to this clinic in the future. So that's kind of a quick overview that wasn't as quick as I had wanted it to be. So, but now what I'd like to do is just kind of, if there are questions, if someone wants a little more information, if I didn't explain it well enough, if I glossed over it, if you want to ask me about some of the activities that I like, if you want me to bring my wife up, now it's up to you guys. So.
I have a question.
Yeah.
So, if we want to see you, do we need to basically make you our primary, or are we okay to still keep our primary, but come to you if we need to, or it's, hey, I rolled out my ankle, I need to come see you right away?
So the question is, can you keep your primary? Do you need to switch to me? You can keep your primary. Right now, I am doing primary care in the sense that if I am seeing you primarily for athlete stuff and you have not selected a primary doctor or want to switch and you have limited medical issues, I will handle those and I will function as your doctor. Now let's say you come to me having not seen a doctor for a while, you've been working out, you feel that you're happy and fit and you don't have any medical problems. And in my initial examination, we identify some medical issues. And this is, I'll use an example of a patient that I have right now. He's not in the audience. The 43-year-old Hispanic male, former competitive MMA fighter, did some minor league baseball, eats very healthy, has an active lifestyle. Unfortunately, I identified a very severe case of diabetes and hyperlipidemia. So fortunately, we have a very good disease management program through our pharmacist, Irene Hanna. And so in conjunction with her, the two of us are managing his diabetes, getting his daily blood sugars down. It's still a little too soon for me to recheck his hemoglobin A1C. But if we continue to make progress, I'll stay on as his primary doctor. But let's say that I identified a case where there was very complicated medical illness that maybe one of my primary care colleagues is probably better equipped to manage. Then I would probably have you see them if you weren't already, or have you stay with them. And then the other issues that are specific to either your injury, your athlete optimization, or personal optimization, we'll continue to manage. And right now, even though we're an HMO, typically you would, in an HMO setting, have to have a referral if you had another doctor to go see a subspecialist, which I'm functioning kind of a little bit of both, a little bit of primary, a little bit of subspecialty. Right now, as an HMO, you don't have to. So if you decide, let's say you do something tomorrow, and you've injured yourself, and so Monday you want to come see me, you can call and make an appointment with me directly. Okay? So, thank you. Okay. Anyone else? There's got to be other stuff.
I have a scenario, Dr. J.
Yes.
And I'm going to pick out one of our athletes. I'm kind of going to embarrass her because she has no idea this is about to happen. But this is Ruby right here. And I watch Ruby work out, and she's really fast, and she lifts pretty heavily, and she doesn't roll her eyes at me when I yell at her. And Ruby says, "Hey, Dr. J, I'm not really injured in everything or anything, but I still want to get my performance levels up. George is doing everything he can. Miguel's doing everything he can. I read what Laura posts, but I want to optimize. I want to even get further in my fitness lifestyle. Not necessarily competitive, but my fitness lifestyle. What can you do for Ruby?"
Okay, so in that scenario, if you came in to see me, that initial hour visit would involve an intake that is a little bit like what you've experienced with a regular doctor. I'm going to ask Some of those basic questions about your medical history and your family history and past surgeries and allergies and injuries. And then I'm going to get specific into the nitty-gritty of this optimization, this why do you want to get better? What are you doing right now? What happens before you do it, during, and after? I'm going to talk and want to know about your nutrition. Now, unlike a nutritionist or a dietitian who might give you a meal plan, that's not what I do. I start with what it is that you're doing with your nutrition. In a lot of cases, I help individuals identify where the gaps were in their nutrition. Sometimes it's just a matter of if people aren't tracking. Once you start to track, you start to either realize, oh, I don't eat as well as I thought that I did, or I'm eating more than I thought, or interestingly, I find in a lot of cases, even for people who are struggling to lose weight or they're gaining weight, that it turns out that they're actually eating less than they should be. Even if they're eating all kinds of crap, they're still not putting the right amount of calories into their body. And that can have an effect on your metabolism, and it can have an effect on your fat storage and your lean body mass. So that's one of the things that we'll identify. And then it's a matter of then also figuring out what exactly is it that you're hoping to improve. And if it's just simply an issue of body mechanics, then maybe through my physical examination we identify an injury and we can treat that injury. Maybe it's identifying a particular deficit in range of motion that can be corrected, not related to an injury, but maybe a muscle imbalance. Or maybe it does turn out that we order some labs and we identify either an area where testosterone, estrogen, progesterone, or even your growth hormone. And I didn't talk about that when I was talking about bioidentical hormones. But I do look at growth hormone. And I don't prescribe growth hormone because, again, it's a wonderful drug if you have a true primary growth hormone deficiency, in which case you're typically about 4 foot tall at the tallest, okay? Then you do need true growth hormone, okay? All right. Bodybuilders, competitive bodybuilders have injected straight growth hormone with phenomenal results and very quick results and very devastating long-term consequences that are not reversed when you stop growth hormone. But I can prescribe an injectable polypeptide that safely stimulates your pituitary gland to improve and increase the production of your growth hormone to levels that are more consistent with where they were when you were in your 20s and 30s. It is a normal phenomenon for all of us once we hit about 35 for our growth hormone levels to drop. And so by using this polypeptide, you can safely increase your growth hormone levels. You won't overdose. You can't overstimulate the pituitary gland to make too much. The benefit of this is phenomenal. This product, which is called Samorelin, increases endurance, it increases recovery. So I have seen cases where people have gone out and just murdered themselves over the course of a weekend, and whereas you would typically be shredded for the next couple of days, they have been using Samorelin, just bounce back, kind of like how sometimes if you look at an 18-year-old and you're like, how do you do that, okay? And you know, these are people in their 40s or so. I have seen individuals using Samorelin who have had rapid recovery from injuries. And so I can think of one guy who was a competitive strongman competitor, had a rupture of his gastroc muscle, which is your calf muscle. And on Samorelin, the healing without surgery was increased with this product. Now, when I was down the hill doing this in concierge practice, our large group of our patients were public service. So fire, SWAT, police, sheriff. One of my colleagues, so he wasn't my patient, but one of my colleagues was treating a local firefighter who had been on Samorelin for just all the other benefits, but unfortunately fighting a fire sustained third-degree burns. Now, he was treated at Arrowhead, which is the regional burn center. They've got a phenomenal program. And he had grafts done. Now, third-degree burns, I won't go into the details, but that's full-thickness burn. That is significant even in a small portion of the body. He sustained it over a large portion of his body, so he was very fortunate to be alive. He was going to be disfigured for life. There's no way around that. But the healing and the way that his grafts took, no one could understand how in someone who was in his, and I don't remember exactly because again, he wasn't directly my patient, but he was somewhere in his late 30s, early 40s. And so again, healing after an injury, after a trauma, after a surgery, as you get older, even if you are fit, is a little bit reduced than in someone who's younger. But even the surgeons there were amazed at how well his grafts took. All that we could posit was that maybe it had something to do with Somorelin. So it is a wonderful product. So again, that would be something in this type of patient scenario, in looking at hormones, that may be a way as well to try to get that optimization that that individual may be looking at. And it may be one piece of that, it may be all of that, and it may be a stepwise fashion. So in some cases, we might find an immediate fix and get you right back out there and get you going in the direction you want to go. In other cases, it may be kind of a long-term stepwise process. So, okay. So, yeah, go ahead.
Okay, hi Dr. Ray.
Hi.
So I work 9-hour days. Okay, I go home, I change, and I work out. I've been working out for maybe a good solid 4 or 5 months now. And my drive is there, so I'm trying to work out 5 days a week. Okay, and my question to you is, what do you recommend on recovery? It's hard for me not to attend. I feel almost guilty because I obviously want the results and I'm more passionate about it more than ever. And then to be told, well, you need to recover, it's a little hard. So, I've been told my body may be used to it, or I don't know. What do you recommend as far as the recovery?
So recovery is a really exciting field right now in athlete wellness and medicine. And there's a huge focus being put on it from the professional level. And if anyone is a follower of soccer, which you all should be because it is the most amazing sport on the planet next to mountain biking. So if you watched recently when the U.S. men's national team played Mexico, and they played in Mexico at elevation. So that stadium in Mexico is at about 8,000 or 9,000 feet. The games leading up to that, the U.S. men's national team, their coaches, their trainers, made sure that each game leading up to that was at a certain elevation for the athletes to acclimate to that altitude. That was one part of their recovery strategy. The other part had to do with optimizing their sleep, their hydration, and their nutrition prior to the games, during the game, and after the game. So the idea of recovery is a complex strategy. And so there are a variety of things you have to look at as an athlete to make sure that you're doing and optimizing and utilizing recovery strategies to get the best out of your workouts. But the other important part is also taking a look at whether or not you've been overtraining. And that's another very exciting and interesting concept that's really getting a lot more attention now, in recognizing that people, and again, I think I see this more and more as some of us get older. We don't want to lose that competitive edge, and we fear if I miss a day, I'm going to lose my gains, and then I'm going to get lazy, and then I'm going to lose it because as I get older, well, you got to keep it up, okay? And you do put yourself in a state of really risking that overtraining, which can be devastating because it can undermine everything that you're doing. It can increase your risk for injury. It can affect your mood. And if you are really in the later stages of overtraining, it can take a lot longer to get you out of it, which then, that has challenges too, because if you are someone who finds so much either enjoyment or personal reward, stress management out of those workouts, even if they have been contributing to your overtraining, when you stop them to try to get out of overtraining, it can take you in a negative way. So, and these are topics that as we continue to do this high performance workshop, I will talk more in depth. Just really quickly, there are ways to look at your recovery. Then there are a couple of really cool tools out. And if you guys see on my right wrist, I have one of them. It's called a Whoop, W-H-O-O-P. And this is one of the only wrist-based monitors for heart rate variability. So on my right wrist, I have my Fitbit, which is, your step tracker, calorie monitor. Okay, this doesn't have a screen. It's just monitoring my heart rate, but then rendering a heart rate variability score when I wake up in the morning. Now, this was a gift for my birthday over the weekend, so I've only had it on for a couple of days. But my wife and I have been using a product called Platelet for about 1.5 years. And that's an app you can download, and that uses like a CardioSport or Polar chest strap, and you get up in the morning and you just, right before you do anything, you take 60 seconds and obtain your heart rate variability. And it gives you a quantitative score and a qualitative score. So quantitative numeric score, and the qualitative yellow, green, or red, kind of a stoplight type mentality. And so you get both. And the idea is that it's telling you, is today a good day to train hard? Is it a good day to take it easy? Or is it a good day to do nothing? So I've been using that for about 1.5 years. I'm using this for 5 days. And then there's another one called Elite, which is one of the other more common one, Elite HRV. And again, it's an app. They're both free. Elite and Elite are both free. You just have to buy the chest strap. So I started using Elite a couple of weeks ago because I've seen some patients and some other people have talked about it. So I'm using myself as an experiment to see what the readings are like, because technically they all should match, right? I mean, my HRV should be the same no matter what, and yet I'm finding discrepancies. So it's a science that's been around for about 3 decades. Okay, the gold standard for heart rate variability assessment is an EKG. Well, none of us are going to have EKGs at home. So these devices, whether it's chest strap or wrist-based, are trying to extrapolate the data. And heart rate variability means, without getting uber fancy, if you guys can picture what you see on an EKG. So that big spike, that's your R wave, okay? So heart rate variability looks at the time between each of those R spikes on that EKG. And that is a measure of the balance between your autonomic system. Your autonomic system is made up of 2 components, a parasympathetic and a sympathetic. The sympathetic is the, oh crap, there's a bear behind me, I'm gonna wet my pants and get out of here really quickly, right? Heart rate goes up, adrenaline kicks in. And parasympathetic system is that, hey, let's chill, let's take it easy, I'm kind of calm, I'm kind of mellow, okay? Digestion, all of that kind of stuff, okay? You want your parasympathetic system to have good balance on that recovery. But at the same time, for optimization of your performance, you want to be more in that sympathetic zone. So these devices are supposed to give you, an idea of where you're at. They're good to a limit, okay? They're good in how well you are standardizing your use of them. Okay. They're obviously limited by their technology. If you've got problems with your phone, your Bluetooth, that might affect it, okay? Then they're also good with how well you understand what the variables mean and how it correlates to you individually as an athlete. That's one of the reasons why I'm using myself as a test subject. Now, Whoop, I'll just say really quickly, Whoop is kind of interesting because being wrist-based and wearing it 24 hours a day, it's gathering this information on me all day long and then rendering my HRV kind of retroactively once I wake up. It senses that I've been awake and then it goes back just before I woke up. It takes that data and says, this is what your HRV was right before you wake up. So theoretically, from their science, they argue that it's the most accurate because it's gathering data on you 24 hours a day. And because it's taking that information before you've woken up, you haven't stimulated your sympathetic nervous system, which is a common phenomenon when you wake up. I don't know if you guys knew that many cardiac arrests, many myocardial infarctions, heart attacks, occur in that waking period because it's tied to an adrenaline rush, which can put a strain on a heart that's particularly vulnerable for it, okay? So the argument from Whoop is that you're getting more accurate measurement of your HRV and your strain. I don't know if that's necessarily true, but I'm wearing the device. This is a $500 device, though, so it is a little more spendy. Okay, it is, but they've tested it on professional athletes, and they used it for a few years on athletes in the Boston area, so the Boston Red Sox. That's where the company's based out of. And I have a connection with the company. Their CTO, Chief Tech Officer, is actually the son of one of my research mentors from where I went to undergrad. So I've got a little bit of an in with trying to gather more information on their science, and maybe even kind of as we grow, make us some kind of connected organization to study this device in, say, competitive non-professional athletes. But I can't make a claim to the benefit of any of the devices. But elite HRV are definitely more inexpensive options. Okay, so yeah, you're welcome. Anyone else? All right, I'm long-winded, I know. I swore that I was going to be done talking in like 20 minutes and then make it so. But I appreciate everyone's attention. And again, as we do this next one, and I don't know if it'll be in a month, if it'll be in 2 months, but the focus will become on particular topics. And these can be driven by your interests. So if through the HLF Facebook, you guys start to post, hey, what about this? Can we talk about this? And it may not always be me. It may be that there are other experts that I bring in. My wife is a rheumatologist, but she also is part of a group called Bite Nutrition, which is online nutritional coaching. Prior to her joining Bite, she was part of Eat to Perform, ETP, and Bite was evolved out of a group of people that left ETP. So she has some information and a different perspective on certain things that is advantageous. I have a colleague who is a behavioral nutritionist and again has other strategies, other skills, other experience and knowledge that he can impart, and so we may involve him, and he may actually even join our staff eventually to kind of help round out this idea of athlete wellness. So, okay. George?
Thank you to Dr. J. Thank you. Now, if you joined us online tonight, we wanted to thank you for joining us online tonight, because this is the first in a series of our high performance clinics for optimum fitness performance, and we'd like you to stay in touch with us. So if you join us online tonight, please go to hvvmg.com and come and join us as we grow. Not only can you grow in your fitness lifestyles, but you can grow with us in this magnificent, amazing facility and program that we're developing here. So if you're looking for fitness from the age of 12 to the age of 112, we've got something for you. And tune in the future as we look at more workshops, maybe based on recovery, on preparation, or maybe even HRV and how it can optimize your performance. Again, thank you for joining us today. Look for our next workshops. Workshop number 2 will be coming soon. And join us on Facebook at Heritage Life Fit. And again, thank all of you for being here tonight. Another big hand for yourselves. Okay. Hey, and before we check out, let me remind you, and let me remind you out there who are watching us, fitness is the answer, and we don't even care what the question is. Can somebody give me a BAM? BAM! Have a great night, everybody. Thank you very much.